Hi guys, Lynn Spence here again. The past few years I've been working, I have noticed there are certain statements they say at work that if you think about hearing it outside of work, it's kind of dodgy. My brain has been trained over the years to watch out for potentially naughty stuff in what people say or what I say because, well, my dad and my uncles, when they're together, they can turn any innocent words into something else. And also because of Lawrence or like going live, there are certain things that I say in the live that they will twist into something dodgy. So sometimes before I even say it, I can think about it already, and then it makes me laugh. I guess I carried that all the way to work, and I have noticed these things. So ODPs or anesthetic assistants, they have the keys to the control drugs because obviously we'll have a lot of control drugs for anesthetic purposes. They have to check those drugs before they start and then after they finish. And you would hear them. They would talk to each other and be like, "Do you want to do drugs with me?" And then the other one would be like, "Yeah, come on, let's go. Let's do it." We do orthopedic cases. We used x-ray a lot, and I like to fix the fracture. There's different parts of the bone, and there are joints where you have like a ball in a socket, and the term for the ball is, they call it head. Sometimes they have to see the head. So the surgeons will tell the radiographer, "Can you move? I need to see a little bit of the head, please. Please show us a little bit of the head." And I will just be chuckling on the side. I'm a scrub nurse, yeah. The dynamics in theater is like this. You have three different teams. You've got the anesthetic team, which includes the anesthetist and the anesthetist assistant, and then you have the scrub team where you have two scrub nurses and an HCA, and then you have the surgeons. Surgeons are in charge of the operation itself. The anesthetist is in charge of the patient's general well-being, so that includes keeping them alive, maintaining their temperature, keeping them pain-free from the procedure. The scrub team, we are in charge of the equipment, the sterility, making sure that nothing gets left inside the patient, or whatever we use. So we have to count everything before we start, and everything that we will put in the operating field, like all the instruments, all the swabs, sharps, everything. Sometimes when we have new people, you have to teach them, how do you do this count? Because there's a certain way of doing it. You want to count with her? Do you know how to count? We have a strap that we use. To keep the patient's legs in place, prevent it from falling off the table, especially if you have to move the table, side to side, up, down. To be able to visualize some of the organs, we have to ask anesthetists if they're ready, especially for doing a spinal anesthetic. They want to check, whether the patient is still able to lift their legs up or down. Before we put the strap, one time the anesthetist was like, "Okay, I'm ready for the strap on." And when I'm doing flexible cystoscopy, I've mentioned to you before, when the patient comes in, the urologist will be the one to talk to them and explain to them the procedure, why they need the procedure. Then I'm meant to get them ready. That's when I would be like, but obviously I have to introduce myself first before I tell them, take off your trousers and stuff. My dialogue will be, "Hi, my name is Christine, I'm one of the nurses. I need you to pull your trousers down in your underwear and lie on the bed, please." Some of them, like, there's no other setting that would be acceptable. Like, how do you just go and meet someone and be like, "Hey, my name is Christine. Now I need you to just pull down your trousers and your underwear." Sometimes patients even tell me, "What? You haven't even bought me dinner." I hope you like this video. Give it a thumbs up if you like it, share with your friends, and subscribe to my channel. I'm an Enjoy without a name. Don't fall in love. And it's funny when